Okay, so now the next thing is ascariasis. Okay, like I said, guys, ascariasis, this is going to be caused by the worm. Basically, it is going to be your ascaris. And how is this ascaris going to be, guys? Ascaris is going to be long, okay, and it is going to be like curved towards the end. Males are going to be curved, whereas females, they are going to be straight. Okay, so let's try to quickly put this thing down. Okay, so if we talk at the causative agent, guys, the causative agent, this is going to be the roundworm. Okay, that is your Ascaris. In full terms, it is called as your Ascaris lumbricoides. Ascaris lumbricoides. And guys, when we talk about this Ascaris, you will see that Ascaris shows two different forms. Like I said, the males, they are going to be different. The females are going to be different. So if you look at the females, guys, the females, they are going to be somewhat straight like this. Okay, they are going to be long. They are going to be elongated, something of this sort. This is the female worm. Okay, but now if you look at the male worm, guys, how is the male worm? The male worms, they are going to be short, but they are going to be curved towards the ends like this, guys. They're going to be curved towards the end. And now they are going to have something called as the pineal setae. They are going to have this pineal setae. Okay, so that is the characteristic. Okay, so this is how the male and female are going to be. But now, once again, guys, because the males and females are different, what do we call them? These two things, they are going to exhibit sexual dimorphism. They exhibit sexual dimorphism. And guys, if you look at these worms, okay, these are going to be covered by cuticle. Okay, so they are going to be like a nice and crunchy. If you will like stamp onto them, then immediately they are going to have that cracking kind of sound out from their body. Okay, so that is highest. Go on. Okay, sure. Okay, fine. But now, guys, when we talk about these, what is their body plan? So remember, guys, when we talked about your, kingdom Animalia, we had always said that, we have some kind of a body plan for these organisms. So in this case, the body plan is, guys, the tube in a tube kind of a plan. So we said, this is a big tube, like this is going to be the body. And this body, guys, inside this body, you are going to have one more tube like this. Okay, this is going to be your alimentary canal. At one end, it is going to be the mouth, and the other end, it is going to be the anus, right? So this is the mouth, and this is the anus. And what is this, guys? This is nothing but the body plan. This is called as tube within a tube or tube in a tube body. Okay, where the mouth and the anus are going to be completely different. Okay. Okay, but now, guys, the next question is, how is this Ascaris going to spread? Like, what really happens out over there? Okay, sure. So let's try to see this thing. So, guys, the mode of transmission that we are going to have, this is once again the fecal-oral route. See, when we talked about your amoebiasis, in that case also the mode of transmission was fecal-oral route. So, guys, once again, like the whatever precautions that we have taken in your like amoebiasis, they still are going to be the same way in this thing also. But here there are a little things more. So let's try to see. So, guys, once again, let me just put down transmission. This is through the fecal oral route or the anal oral route. Okay, so whatever you like to call it. But then how does this thing happen? So let's try to see the entire life cycle of your Ascaris. Okay, so guys, the first thing that is going to happen is we are going to start off with Ascaris. Okay, now this Ascaris worm, basically, okay, it is going to be present, okay, Maybe, okay. It's going to be present in your intestines, okay, or it is going to be present on the outside. Okay, so let's say we are talking about the intestines first, and we're going to go into the in-depth process. So this worm, basically, it is going to produce the eggs. Okay, so Ascaris produces eggs. Okay, but now, guys, you know what? When we talk about the eggs, the female out over here, guys, she is capable of producing 2 lakh eggs per day. 2 lakh eggs per day. But now, guys, when we talk about these eggs, the eggs, they are going to be of two types. So we can have either your fertilized eggs or we have the unfertilized eggs. Okay. So now, guys, if we are looking at this for unfertilized eggs, these unfertilized eggs, they are not going to be of any harm to us. So these are non-pathogenic. So we don't have to worry about it at all. So these are non-pathogenic. But on the other hand, guys, now what are we going to see? We are going to have the fertilized eggs. And these are the real problem. Okay. So we have these fertilized eggs. Now what happens? Guys, these fertilized eggs, you are going to see, okay, that somehow or the other, now they are going to enter into your body. How? It is going to enter through the fecal-oral route. So let's say someone had defecated, and because of some reasons that fecal matter got access to your water body, and that water you had it. So now, because of that, now you are going to see, guys, that now this is going to enter into your body through the fecal-oral route. Okay. Now, once it has entered through the fecal-oral route, now let's try to see, guys. Okay. Now the situation is going to appear something of this sort. So see, we are going to have the stomach. So at the present moment, they are going to be in the stomach. Okay. And it is going to be in the intestines. Okay. So now, guys, see, initially they were in the stomach, but now it happens so that, guys, these fertilized eggs, they are going to be really, really strong. Really, they are going to be like really, really sturdy, so they can withstand the acidity of the stomach. Now, what happens, guys? These things, they are now going to slowly pass into the intestines, and as they move into the intestines, guys, these eggs, they are going to mature into the intestines. The fertilized eggs mature in the intestines. Okay, now once they start maturing out over here, okay, guys, now what happens? See, they are going to mature, they are going to become small worms, but then they are not going to stop out over here. From here, guys, they are now going to bore holes into the intestines, okay, and now they are going to try to get access to other parts. So, okay, so once this is done, they bore holes into the intestines. Okay, once they have bore holes into the intestine, guys, now from there, they are going to enter into the blood and lymph. Okay, now from the blood and the lymph, now, guys, they are going to get access to the lungs. Okay, so they can enter into the different parts, but their main target is the lungs now. So from there, they reach the lungs. Okay. Now, once again, guys, as they reach the lungs, now what are they going to do? They are going to bore holes into the alveoli. Okay. Now, as they bore holes into the alveoli, guys, slowly, slowly, now they start moving into the trachea. Okay. So slowly they move into trachea. But now, as they move into the trachea, guys, now what happens? From the trachea, they are now going to move towards the mouth. And slowly, sometimes, whenever you cough and all, suddenly they come into your mouth. Now, let's try to see this thing. Okay. So they move towards the mouth. Okay. And now, as they move towards the mouth, guys, they are going to move along with the cough. So whenever you cough, they are going to come out into your mouth. Okay. But now, guys, now what happens? See, the moment there is something coming into your mouth, you have two options. Either you're going to spit it or you're going to gulp it down. Now, if you spit it, guys, that is fine, not an issue. Okay. Now, if you gulp it down, then there is a problem. But then most of the times, like every time, guys, you're not going to be like, that you're going to always keep on spitting here and there, here and there, here and there. So sometimes it happens that, suddenly you get a little bit of cough, you are going to swallow it. Same thing happens out over here, guys. So the moment it comes back into your mouth, your tendency is to swallow it. Okay. And that is the biggest mistake, guys. So the moment you swallow it, now what? Once again, these worms, they are going to reach the intestines. They are going to withstand the HCl from the stomach. And from there, they are going to enter the intestines. So worms reach the intestines. Okay. And now the moment they reach the intestines, guys, now once again, what? Once again, the same situation. So they are going to reproduce, and they are going to reproduce and give rise to more Ascaris. Okay, they reproduce and give rise to more Ascaris. But once again, what happens the moment they reproduce, guys? Once again, males and females, they are going to differentiate, and the moment they differentiate, you are going to have females producing 2 lakh eggs. These eggs, where are they going to come out from? They are going to come out from your fecal matter. So whenever you pass stools, along with that, some amount of these eggs are going to be there. Once again, some of them are fertilized, some of them are unfertilized. Unfertilized eggs, we don't have to worry. Fertilized eggs, we have to worry. And once again, the same cycle keeps on continuing, guys. This is nothing but your Ascariasis. So, guys, here in your Ascariasis, the entire cycle starts with Ascaris. Okay, is everybody okay with this thing? Guys, just have a look, just see if you're okay. Everybody, if anybody has any doubts regarding this. In which phase in which phase does the stomach pain start? It starts from here when it starts maturing in the intestines and all there. Now this is just the first we are talking about, guys. When they mature in the intestines, they are going to grow a meter long. Okay, if you don't treat it, then you're going to just have it like meter long, then it is going to cause problem, severe abdominal problem, cramps. Then you're also going to have like constipation, then flatulence. All of that is going to happen here. Okay, these can reach your brain. Yes, there have been instances where Ascaris is, instead of like entering into the lungs and coming through the trachea into your mouth, they have found targets into your eyes also, and they have been found in the brain as well. So really, really deadly. I'm damn sure everybody, when you were young, you must have suffered from worms. Okay, and you must have heard of this tablet called as Rantaxentel. Okay, Rantaxentel, something like that. Okay, and that tablet basically you take once in 6 months, or the syrup also you take once in 6 months. So that is for this thing only. Like if you are having any kind of worm problems and all, it is going to flush your entire intestines that way. So everybody all right with this, guys? Any doubts anybody wishes to ask? Okay, sure. So now let's try to move ahead. But now, guys, what are the symptoms? See, guys, what are the main targets out of here? The main targets is going to be your intestines, and the second one, it is also going to be your lungs. So you are going to have some trouble regarding your lungs, guys. Okay, so keep this thing in mind. Okay, so now what are the symptoms out over here? Okay, so the first thing that you're going to see is, guys, you are going to start observing the eggs in the stools. Okay, and this is going to start like somewhere 60 to 70 days after your infection. 60 to 70 days in your infection, you start seeing like small eggs. Okay, but then generally I don't think so. uh oh, okay, it can happen, yes. Okay, Now, guys, generally you don't tend to see your stools that way. Okay, nobody has this. Like, I don't think so. Like, everybody checks, like, what is there in the stool, how is it, what it looks like, and especially, like, if you are like using the English type toilet, that is a commode. Okay, you won't really see your stools. But if you're using the Indian style, then definitely you will look. Yes, and absolutely, you should always keep a check on your stools. It tells a lot about the state of your body. Okay, so guys, initially it starts with eggs in the stools, and then you are going to see live worms. Okay, live worms coming in the stool. Okay, small worms, like small white maggots kind of thing. Okay, like constantly moving and all. It is very, very evident. Okay, so then it is going to be that the moment you have a situation like this, immediately you need to alert your parents and see some doctor. Okay, the moment this thing is going to happen, now you're going to see we are going to have intestinal discomfort. Okay, intestinal discomfort, we are going to have intestinal pain. Okay, we are going to have cramps, we are going to have constipation. Like I said, constipation is when the amount of stools is going to reduce drastically. Okay, reducing to one per week kind of thing, constipation. And why is all this thing happening? Why are you experiencing all this thing? Because the worms block the entire intestine, guys. Okay, so they are going to form an entire blockage intestines. Okay, fine. Then the next thing, guys, the next thing you're also going to see, I told you they are going to enter into the lungs also. They're going to bore holes into the lungs. And because of that, you are also going to experience pneumonia. Okay, what is pneumonia? Fluid fills into your lungs, and this is going to result into infection. That is pneumonia. And then because you're having all these worms and all running through your blood, running through your lymph, again moving from one place to another, immediately your eosinophils, they are also going to increase in number. Because see, eosinophils, when are they going to increase? In the case where there are allergies or anything, here the body thinks something is wrong, immediately the eosinophil levels are going to increase, resulting into eosinophilia. So these are, guys, some of the symptoms. Okay, but now if we talk about the precautions, okay, so what are the precautions that you need to take? Guys, once again, the same thing, same as amoebiasis. Okay, so if you remember, washing your hands before and after the loo, before and after having meals, washing your hands with soap, washing your hands with warm water, yeah, I mean scrubbing your hand while washing them. Okay, then boiling your water, allowing it to sediment, then filtering the water. All those things that we talked about, bathroom hygiene and all that thing is going to be the same out over here. Okay, sure. But now the next thing, guys, next thing is how is the treatment? What are we going to do if you are going to suffer from amoebiasis? Sorry, from your ascariasis. So, guys, in that case, what are we going to use? We are going to use ascaricides. Okay, what are these ascaricides? Ascaricides are nothing but your ascaris killing drugs. And who are these? We have mebendazole and albendazole. Okay, mebendazole, albendazole. Okay, and other ones that are there, guys, we have piperazine, then we have pyrantel, piperazine, pyrantel, and the next one that we have is your levamisole. Okay, so levamisole. Okay, so this is this is what we need to use as treatment against your ascaricides, guys. Okay, so if you wish to remember this thing, guys, you can remember the treatment as ma people. Okay, ma people doesn't make sense, but it may help you to remember. Okay, because guys, here in this chapter, we are going to have so many names of drugs. You need to remember them somehow or the other. I remember it in this fashion. So you can also remember either this way or you can come up with your own things, not an issue. Okay, guys, just have a look, just see if everybody is okay. Then we can move ahead on to the next one. Okay, and guys, these medicines and all, na, they are like very, very important from the NEET point of view. Okay, because what is going to happen is in your NEET exams, guys, they will ask you like, find the odd man out, or, like who is the right one amongst the options. So you have to be ready for that. Okay, so keep this thing in mind, guys. Okay, all right, everyone, guys. Are there different types of worms? Yeah, yeah, there are different types of worms. So this is just one, Ascariasis. Then there is tapeworm. Okay, so that is Taniasis. So which is also going to be like really long. Tapeworms grow up to like 3 meters in your intestines, guys. 3 meters. So which is like really, really huge. If you have ever seen a dog suffering from tapeworm, guys, they actually pull the worm out of the anus and they roll it over a stick because it is so huge. It's that way. Okay, chalo. Let's try to move ahead. Yes, 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 yes. In your see, if you have ever seen that video, okay, now Himanshu is saying that he had seen a video on YouTube where the doctors were like removing worms from the intestine. Now there are two things. Okay. There are two very famous videos which are on YouTube. In one in which their doctor is like undergoing this surgery, and they cut open the intestine, and inside you will see noodles, like live noodles kind of worms. Those are ascariasis. They are completely blocking, and what they do is like you know they put their hand in and they are like pulling out all the worms one by one, that way. So yes, that is ascaris. Okay, tapeworm, these are like flat worms, tapeworms. So I don't think so you must have seen that, but you must have seen ascariasis video. Okay, sure. Okay, but now let's try to move ahead. Okay, the next one that we are going to see, guys, we are going to have your pneumonia. Okay, so now, guys, when we talk about pneumonia, what is this pneumonia? How is it going to be? See, like I told you, you know, when the worms are going to infect into your intestine, in your lungs, then they are going to bore holes into the alveoli and all. Okay, the same thing, guys. What is going to happen? You are going to see first, there is going to be fluid retention. Okay, and then you are also going to see inflammation taking place in your lungs. That is nothing but your pneumonia. So first thing, guys, pneumonia, this is going to result in the inflammation of lungs. That is nothing but your alveoli. Inflammation of lungs or alveoli. And second most important thing, guys, there is going to be fluid retention. Okay, fluid retention inside the lungs. Okay, now when you do this thing, like guys, when you do a scan, like if you're suffering from pneumonia, if you have any symptoms like that, then they will do a scan of your chest. Okay, so basically they will take an x-ray. But in x-ray, what are you going to see? You are going to see consolidation. Okay, the consolidation meaning you are going to see some nodules like things, or or some circles kind of thing that will be observed in your x-rays. So that is called as consolidation. Okay, so you're going to see some consolidation, and along with that, you're also going to see some exudation taking place. Okay, so that is how this is going to be. Okay, next thing along with this, we are also going to see who are the real causative agents who cause pneumonia to you. So, guys, there are many agents, many things which are going to cause pneumonia. So, let's try to see what. Okay, so first thing, guys, we are going to have bacteria. Okay, different causes for pneumonia. So we have bacteria. So if you're talking about bacteria, who is the one? We have Streptococcus pneumoniae. Okay, Streptococcus pneumoniae. Okay, second one, guys, we have fungus. Okay, different kinds of fungi. They are also going to affect and they are going to target your lungs, and then you will get pneumonia. Okay, but then the next one we have is your viruses. Okay, so in your viruses, who are we talking about, guys? We are talking about para-influenza virus. Okay, so we have para-influenza, we have adenovirus, para-influenza, adenovirus, we have RSV, respiratory syncytial virus. Okay, and the last one we have your influenza virus, guys. Influenza virus is what? Haemophilus influenzae. Okay, so these are the four ones, guys. Okay, I'll just write this down. This is Haemophilus influenzae. Okay, now, guys, how are you going to remember this thing? You are going to remember this as PERI. Okay, so para-influenza, adenovirus, respiratory syncytial virus, and your influenza virus. Just remember this as PERI. Okay, but now, guys, the last cause. Okay, you may have also experienced that people who have suffered burns and all, maybe second degree, third degree burns, they also suffer from your pneumonia. Okay, and why is this, guys? Because chemicals and all, they are going to affect your lungs. They are going to burn out the lungs, cause inflammation, and allow the water to be retained. So this can also happen through various kinds of chemicals, or it can also happen because of burns, etc. So this is what we need to know about your pneumonia, guys. Okay, so the causative agent. Okay, but now let's try to see what are the symptoms. Okay, what is going to happen throughout. Okay, so guys, see, this is the one which is going to affect your lungs. Okay, and if the lungs are affected, definitely your breathing pattern is going to be affected. There will be coughing, okay, or you will have like cough or sometimes blood coming out. Okay, so that way. So guys, let's try to see what are the symptoms out over here. So guys, first thing, you are going to have fever, headache, chills. Okay, fever, headache, chills. Okay, these are some common symptoms. Okay, but now, guys, here the most important thing that you're going to come across, you are going to have this peculiar kind of cough. Okay, now, guys, cough in scientific terms we call this thing as phlegm. Okay, but now, how is this phlegm, guys? The phlegm is going to be somewhat greenish yellow. Okay, it is greenish yellow. Guys, I'm damn sure you must have suffered from like cough and cold, right? And sometimes you have tremendous amounts of cough, right? At that time, what happens, guys? Suddenly you are going to get this greenish colored cough. Now, if you have ever got this thing, guys, this is like a little off odor. Sometimes it has this pussy odor, or it is a little different. Yes, very, very thick and sticky. Okay, that is one of the clear cut symptoms. Okay, not that you will always have, sometimes under normal circumstances also you get green colored phlegm. Okay, but then you know if you start continuously getting this thing, then this is a cause of concern. Okay, but now, guys, because the lungs are affected, also what happens while coughing, like you are coughing, and along with cough, sometimes your blood also oozes out. Okay, so blood oozes out with cough. Okay, now once again, lungs are affected. So I told you it is going to affect your breath also. So you are going to see shortness of breath. Okay, shortness of breath. Then we are going to have chest pain. Then we are going to see vomiting. Okay, nausea, vomiting, nausea, intestinal discomfort. Okay, however, intestinal discomfort is not that much, but then I'm just giving it out to you. Okay, this is just keep it in mind, brackets. Okay, and guys, one more very important symptom. You are going to see blue skin. So suddenly you start having or you appear to have blue skin on your body. This is your entire pneumonia, guys. Okay, but now what is the medication or what is the treatment that is done? So the first thing that we do, guys, okay, in order to prevent this thing from happening, we are going to take vaccination. Okay, so let's try to see, guys, in treatment. Okay, the first thing is we are going to have vaccination, and vaccination, guys, which vaccination we are going to see? Vaccination which is going to be taken at birth. So we have, okay, like we take the pneumonia vaccine right at the birth. Okay, so that way. Then the second thing, guys, we are going to have some other medicines. Okay, just like how we had mebendazole, albendazole. Okay, same way we have another medicines, guys, like that drugs. Like what we have rifampicin. Okay, we have rimantadine. So okay, rifampicin is for someone else. Okay, so we have rimantadine, we have oseltamivir, okay, rimantadine, oseltamivir, zanamivir, and we have amantadine. Okay, okay, so zanamivir, amantadine. Okay, so guys, these are the drugs that we are going to go for. How are you going to remember drugs for pneumonia rosa? Rimantadine, oseltamivir, zanamivir, and amantadine. Okay, just keep this thing in mind, guys. This will help you to recollect them. Okay, and as I said, guys, you are going to see this thing more in the case of like in your CET. Okay, they will ask you different kinds of drugs. Okay, so guys, just have a look, just see if everybody is okay with pneumonia. Okay, just saying. Okay. Sir, if we have to take all the vaccines till the age of 10 years, as it is given to all, which are given high priority. So basically, the ones, the ones that you take early in your life, okay, like we have the DTP, we have the BCG vaccines, the polio vaccines. These are like, the high priority ones. Okay, because what happens is the chances of you getting these diseases early on in life is more. And that is why those vaccines, they are given early in the life. As you move ahead, your immune system is also going to develop. You are also going to be a little better. So in that cases, guys, then you will see that, okay, the ones that are not of that high priority, they can be given a little later in life, that way. Okay, so guys, what we will do is we'll just break over here for 5 minutes, okay, so that you can once again refresh and on. Okay, and once again in 5 minutes we'll start with the next part, guys. Okay, so next few things. So we have like we have to talk about cancer, we have to talk about ringworm, we have all the other things out over here. Okay, so 5 minutes break, and then once again we'll come back, guys. Okay, chalo, guys. So let's start once again. So now the next thing that we are going to talk about, guys, once again, now we are going to have like simple diseases first, and then we're going to slowly move on to some harder ones. Okay, slowly. Okay. Anyways, chalo. So let's try to see. Okay, so one more thing. Sorry, I forgot to talk about this thing. Okay, so guys, these are the medicines that we said. Like I told you, these are the medicines that you are going to use in the treatment of your pneumonia. Okay, but now, guys, there are some other also. Okay, so just keep this in mind for bacterial ones. Sometimes if you have only bacterial pneumonia, so then these can also be treated. Okay, with Okay, so in that case, guys, we can use only some other antibiotics, like we have your benzyl penicillin. Okay, so we have benzyl penicillin, then we have ampicillin, and we have chloramphenicol. Okay, so these are the ones which are used for bacterial ones. Okay, fine. Chalo. So now let's try to move on to the next one. This one. So the next one is going to be really simple, guys. The next one we are going to talk about is ringworm. Okay, and I'm sure everyone must have seen that BTEX ka ad ke daag khaj khujli mita de BTEX laga le, or you have that a swollen ring kind of thing coming onto the skin. That is nothing but ringworm. Okay, always remember, guys, when we talk about ringworm, ringworm basically it is not caused by worm. Okay, it is actually caused by the fungus. Okay, so guys, what is this actually? Ringworm is also known as dermatophytosis. This is also termed as dermatophytosis. And always remember, guys, one very important thing: this is not caused by worm. Okay, yes, it is a communicable disease, right? Okay, but this is caused by fungi, not caused by your worm, but it is caused only and only by your fungi. And guys, who is the causative agent out over here? The causative agent, okay, this is trichophyton. So we have this trichophyton, or the second one we have microsporum. Trichophyton or microsporum. Now, you know what the best part of these things is, guys. In our lab, okay, in our lab when we were working on trichophyton, what happened was suddenly this guy who was working on this thing, he happened to have a little bit of spores of this trichophyton fall onto his skin. After a few days, he saw that the entire patch of skin, there were no hair, like it was like completely wiped off. So what actually these two is, okay, these two basically they feed on the keratin, guys. Okay, so they feed on the keratin, where they feed on the keratin on the skin and as well as on the shaft of the hair. Okay, they feed on the shaft of the hair, plus they eat sorry, keratin plus they eat the skin. Okay, so this is what is going to happen. But now, guys, what are the symptoms? Okay, what are the symptoms? Let's try to see. Okay, so guys, Like 1 second, like if you remember that thing, you are going to get this thing on all the different places. Okay, it is not only on your hands, it can be on your neck, it can be your armpits, it can be your shoulders, it can be your legs, it can be your groin. Okay, it can be any of those regions. Okay, so what happens, first of all, you are going to see that a red ring, it develops on the skin. Okay, first. Second thing, you are going to see that this red ring, now this is going to be inflamed. Okay, it is going to be swollen up and it is raised. Okay, it is swollen up and it is raised. Guys, I told you this is also going to be seen in other places. So I'll just tell you, this thrives well. Okay, it thrives well where? In the groin region, guys. And when it grows in the groin region, we call this thing as jock groin itch. Okay, if it grows in the groin region, we call this thing as jock groin itch. Okay. Sometimes, guys, this is the one which is going to grow in between your toes. Okay. If it grows in between the toes, then we call this thing as athlete's foot. When are you going to experience this, guys? Generally in your rainy season. So what happens is, like, in the rainy seasons, you will see that, you don't wipe your feet and all, especially when you come out, come from outside, and then the moisture stays out over there. Wherever there is warmth and wherever there is moisture, this is the best place for the fungi to grow. Immediately you will start seeing cracks in your, in between your toes, and that is nothing but your athlete's foot, guys. Okay, last thing out over here, guys. Now this sometimes affects the nails also, and when it affects the nails, guys, we call this thing as onychomycosis. This is termed as onychomycosis. Okay, and what generally happens out over there? See, guys, I'm sure you must have seen some people, like, whose nails are like, yellowish, or they have crumbled, or they are only halfway. You come to know that, it is some kind of your infection kind of a thing. That is nothing but your onychomycosis, guys. Okay, and this is going to result into crumbling. Okay, crumbling and disfiguring of nails, that way. Okay, but now, guys, what is the prevention? Like, how can you avoid this thing from happening? Okay, so sorry. Okay, so when we talk about good prevention, guys, it should be good personal hygiene. Okay, if you are having good personal hygiene, guys, then definitely you are going to see that, you are going to avoid all these, like, the wet places and all, or the warm places. You'll make sure you take good care of it, especially the groin region and all. You will take good care of that. Okay, next thing is, guys, one who is, like, wearing clothes, you should never share clothes. Okay, never share clothes, and especially your towels. Okay, but now, in your families also, you must have seen, sometimes you use your mom's towel, sometimes you use your father's towel, right? It happens that way. But remember, guys, you never know where that towel must have been, right? It must have been used to, clean all the other parts. Okay, the questionable parts of the body. So you don't know where exactly those towels have been. And that is why, guys, you should never share towels, neither share clothes. If for any reason, guys, that, if the person is suffering from some this thing, okay, like, okay, from ringworm, then his clothes should be washed with, antifungal agents. Wash clothes with antifungal agents. Okay, and last thing out over here, guys, avoid walking barefoot outside, that way. If you perform all these activities properly, guys, then you won't suffer from your on this thing, the ringworm. Okay, but let's imagine, guys, once again, if you have got this ringworm, okay, something has happened, you have got this thing, then how are you going to treat this thing, guys? What will you do? So in that case, guys, you have drugs which are available for treatment. Okay, and drugs, okay, you have drugs. And what are these drugs, guys? Drugs like we have nystatin. Okay, sometimes you must have heard of this nystatin powder, or we have this fluconazole. Okay, fluconazole or itraconazole. Fluconazole and itraconazole, guys, these especially, like fluconazole, there is this powder called as absorb. Okay, generally in the rainy seasons you must have seen older people using it. Absorb. Then there is nystatin powder also. I don't recollect, neosporin, nystatin. Okay, these are some other powders which generally come. Okay, but this is what we need to know with regards to your entire uh this thing, the ringworm. Okay, so guys, just have a look, just see if everybody is okay with this thing, and then we'll move ahead with the next part, guys. Okay, chalo. So let's try to move ahead, guys. Okay, let's try to move on to the next ones now. Okay, the next one that we're going to talk about is a very small one. It is dengue. Okay, so not generally in detail as such, but uh, very we're just going to lightly touch it first. Okay, and then after that we are going to have your malaria and we have your filariasis. Those we are going to do it in detail. Okay, dengue is just in short. Okay, so now let's try to see what is this dengue, how is it going to happen, what really goes on out over there. So guys, when we talk about dengue, okay, dengue, this is going to be caused by the bite. Okay, this occurs due to the bite of your female Aedes mosquito. So guys, there are actually three female mosquitoes, like three mosquitoes. We have your Aedes, Culex, and your Anopheles. Okay, so Anopheles causes malaria. Okay, Aedes causes dengue, and Culex causes filariasis. Okay, so always keep this in mind. So this is going to be because of your sorry, Aedes mosquito. Okay, so this is caused by the bite of Aedes mosquito. And guys, this Aedes mosquito, always remember, whenever we talk about this mosquito is always going to act as the vector. Okay, so it is going to be like, the one who's going to transfer the causative agent from one place to the other place. That is how it is going to be. Okay, but now what is the causative agent then? So if uh, the Aedes mosquito is not the real the causative agent, who is really going to cause this thing? So the causative agent is actually a virus, and we call this thing as the dengue virus, guys. Okay, so that way. But now what happens in this thing? Okay, so when you have like dengue, guys, here in this case, the blood platelet count, immediately you will see that the blood platelet count drops down to around 20 to 25,000. Okay, per millimeter cube, guys. 20 to 25,000 per cube. Now, generally, what is your normal platelet count? It is going to be in the range of 2 to 5 lakh per millimeter cube. And now, from 2 to 5 lakh to 20 to 25,000, this is a sudden, this thing, guys, a sudden degradation in the numbers. And at this level, guys, you cannot do anything with it, meaning your blood will no longer act as blood, your blood will no longer clot, and then this is going to be a problem, and this is the time when you see deaths. Okay, but now, guys, is there any like prevention or any cure for this thing? So, guys, yes, prevention meaning is like it's going to be like, you should take care that you don't have mosquitoes around, this, that. Okay, so cleanliness, there should not be stagnant water, all that. But then, is there any drug or anything that is present? So this thing is, guys, no. At this moment, guys, we do not have any treatment as such. The only treatment that we give is that you are going to give the person ample amounts of rest, so that his body can take care of it, and then he will he will recover from it. Otherwise, there is no treatment to cure this thing at all, guys. Okay, so always remember this thing. So that is dengue. That's it. That is what we needed to know about dengue. Okay, but now after this, guys, we will start talking about your typhoid. Okay, so let's try to see what is this typhoid. Who was the first person to really talk about this, and what happens out over here? Okay, so guys, when we talk about typhoid, who was the first person to talk about this thing? He was Louis Pasteur. Okay, and now, guys, because this typhoid, this is known by many names. So let me just put down all the other names that are available. Okay, so guys, this is also known as gastric fever. Okay, this is also known as gastric fever, or this is also known as abdominal typhus. Gastric fever, abdominal. So typhus. Okay, abdominal typhus. Then we also call this thing as pathogenic fever. Okay. Then slow fever. Also infantile intermittent fever. And lastly, we also call this thing as nervous fever, guys. So guys, these are all the different names that are available for your typhoid. Guys, you need to remember this thing. How do I remember this? I remember this as GAP SIN. So gastric fever, abdominal typhus, pathogenic fever, slow fever, infantile intermittent fever, nervous fever. Okay, but now who is the causative agent for this? Let's try to see. So the causative agent, guys, this is a bacteria. And what is the name of this bacteria? This is Salmonella typhi. Okay, but there are different versions of this thing. So let me just tell you who are these. Okay, so guys, as I told you, main causative agent, this is going to be a Salmonella. Salmonella, but now there are different types of Salmonella. So first, let's say we're just talking about Salmonella typhi. Second, we have Salmonella typhimurium. Okay, then Salmonella paratyphi A. Salmonella paratyphi A, Salmonella paratyphi B. Salmonella paratyphi A, Salmonella paratyphi B. These are all the causative agent, guys. Okay, and now how is the transmission going to occur, and what really happens out over there? Once again, guys, it is the same thing. Transmission is going to occur through the fecal-oral route or the anal-oral route. Okay, or the anal-oral route. Okay, but now, guys, we need to see how is this causative agent, how does it really look like, what really happens. So guys, when we look at this one, Okay, you will see that this appears to be something like this. Okay, something of this sort. And what we will see is, guys, it has an outer coating. Okay, this outer coating, we see this is made up of your lipopolysaccharide. Okay, it is made up of this lipopolysaccharide, and this we have an antigen. We call this thing as antigen O. Okay, this is known as antigen O. But now, on the other hand, guys, what are we going to say? That on this entire lipopolysaccharides, now you are going to see that, oh, this has, you know, the flagella, the flagellar protein. Okay, so these are all the flagella which are present, guys, like this. Okay, and now what is this? This is flagella, and this is known as your H antigen. Okay, so from this tail, basically, we remove this H antigen, or we also call this thing as your Hosh antigen. H antigen or Hosh antigen, guys. So this is how the entire structure is going to look like. Okay, but now let's try to move ahead and let's try to see, guys, what exactly is going to happen. How is the treatment going to be, or what really happens out of there? Okay, and if you want, I'll just explain you a little bit more about these two things. Okay, the lipids and the polysaccharides. Okay, so guys, like I said, this is how the structure is going to be like. So we are going to have this lipopolysaccharide, which has the antigen O, and we have the flagella, which contains the Hosh antigen. Okay, so I'll just say that, this is consisting of two types. We have the lipids and we have antigen O. Okay, so this is, we are talking about only about the lipopolysaccharide, guys. Okay, we label this thing as LPS. Okay, LPS. So LPS, lipopolysaccharides. Okay. So LPS, as I said, it is going to consist of lipids, and we are going to have this antigen O. But what is this lipid actually? So you are going to see, guys, there are going to be two phosphorylated glucose amines. Two phosphorylated glucose amines. These are attached to a long chain fatty acid. Okay, attached to long chain fatty acids. And guys, this lipid, this is the actual one who is the causative agent. So this is actual causative agent. Okay, so that is your lipopolysaccharide. Okay, but now when we talk about this antigen O, guys, what is the job of this antigen O out over there? Guys, this is the one which prevents the immune system from recognizing that there is this foreign body which has entered into the system. So prevents the immune system from recognizing the germ. Okay, so that way. Now, but now what happens, guys? See, even if we look at certain animals. Okay, some animals they will never get typhoid. So what is the mechanism behind them? How do they prevent this thing from happening? So what we have observed is that some animals they have enzymes. Okay, some animals they possess enzymes, and these enzymes, what they do is they cleave this bond, this the bond between the phosphorylated glucosamines. So they break down that. Okay, so they break down they break down phosphorylated glucosamine groups. That's it. That is what we need to know a little bit about your lipopolysaccharide. Okay, once again, just have a look at this thing, guys. If you guys are okay, then we'll move ahead the next part. Okay, just have a look first. Okay, everybody, all right? Yeah, right, right. Okay, so guys, let's try to move ahead. Okay, so let's try to see how are we going to see the symptoms. Okay, chal. Okay, so guys, now we are looking at the symptoms of typhoid. Okay, and typhoid is going to have, like, very clear cut symptoms. You immediately come to know that you're suffering from typhoid. First of all, guys, you are going to have tremendous amounts of high fever. And guys, we are looking at fever that is 104 degree Fahrenheit. Okay, which is nothing but approximately 40 degrees Celsius. Guys, remember, this high temperature is not going to be good for your body at all. Okay, second thing that is going to happen is you are going to have sweating. Okay, so we have fever, we have sweating. Third, we have vomiting, guys. Okay, next, you are going to have gastroenteritis because see, this is ultimately going to affect your intestines. So, gastroenteritis. Okay, and finally, guys, you're also going to see some rose colored pimples. Okay, rose colored pimples coming onto your body. Okay, and how are these pimples, guys? These are flat. Okay, not generally, how we have this bumpy kind of thing. No, these are going to be like these flat kind of thing, guys. Okay, only these flat ones like this. That is going to be your the flat red rose colored pimples. Okay, and guys, because the germs and all are present in your body, now what happens is you will see two things that is going to happen. Your WBC count is going to decrease. Okay, and that is going to result into leukopenia. Okay, now how it happens is leukopenia basically, guys, your WBC count is going to decrease a little. Okay, it is not going to decrease heavily, but you will see that it is a little off kind of thing. Okay, but now because this is happening, guys, okay, because this is happening, you are going to see that suddenly you are going to see that the eosinophils, See, when are the eosinophils going to increase? They are going to increase only in the case of your allergies or rashes, right? So here when we have this, this rose colored pimples, guys, you are going to see that in all this is a rash kind of thing. Okay, so here, but you are going to see eosinophilia taking place a little later. Okay, a later eosinophilia. Okay, fine. Okay, finally, guys, now how are we going to identify that you are suffering from this thing? Okay, your like your from your typhoid. Okay, so we are going to have some test, or we say these are nothing but your diagnosis. Okay, chalo. So let's see what are the diagnosis tests that are available. Okay, so the first and the foremost, the most important test, guys, we are going to see diazo test. Okay, so this is a diazo test. This will come out to be positive. Okay, second important thing, guys, we are also going to do a blood culture. Now, see, you must have heard like urine culture. Sometimes you must have had stool culture. Same way, we will also do this blood culture. This will also turn out to be positive. And guys, the characteristic test which is used for detection of your typhoid, that is Vidal test. And this test, guys, this is going to come out to be positive. Okay, now what is this Vidal test going to do, guys? See, the germs were present in your blood, so definitely your WBCs, they must have produced antibodies against them. The Vidal test, it determines, okay, or it detects the antibodies. It detects antibodies in the blood. Okay, and guys, when we detect this antibodies in the blood, like how much amount they are present, we call this thing as titer. Right, so we will always try to find out what is the titer, and depending upon that, guys, we will say whether you are actually suffering or whether you are not. Okay, but now let's see what is the treatment. How is the treatment done? Okay, so now in some cases, guys, what is going to happen is that you are going to have like gallbladder problem, like like sometimes you may have like stones out over there. Sometimes the gallbladder stops functioning properly. Okay, so in that case, in severe cases, we remove the entire gallbladder. Okay, we remove the entire gallbladder itself. Okay, but now otherwise what are you going to use? What are the other kinds of drugs that you're going to use? So we have chloromycetin, like chloromycetin, or you can call this thing as chloromycetin. Okay, so chloromycetin. Okay, so first chloromycetin. Second, guys, we are going to have typhim 6. Okay, now actually you may call this thing as typhim V. Okay, so it is basically your antigen. It is based on the antigen. That is why typhim V. Okay, then we have typhirix. Typhim V, typhirix. And then finally, guys, we have TY21A. And guys, this TY21A, it is actually a live oral vaccine. Okay, and in your exams, guys, this is what they will always ask you. Which is the live oral vaccine? TY21A. Okay, that's it. That is what we need to know with regards to your entire typhoid, guys. Okay, so just have a look, see if everybody is okay with this thing, then we can move ahead with the next part. Okay, chalo. So guys, next thing that we're going to talk about is a little more on the interesting side, okay, and that is filariasis. Now, guys, filariasis, or you must have also known this thing as elephantiasis. Okay, so let's try to see what exactly happens in filariasis or elephantiasis. Okay, so now, guys, first of all, you know, uh, you must have seen, like, it is not so prevalent in our country, but you must have seen, like, in your earlier, standards and all, pictures of people with huge arms, swollen arms or swollen legs. Okay, guys, whenever you see those pictures, like, let me just show you, this is your normal arm. Okay. Okay, so guys, let's imagine this is your normal arm. Okay, so let's imagine it this way. Guys, in elephantiasis, you are going to see that your arm becomes like this, Yokozuna kind of thing, guys. Okay, and it is going to be completely swollen with, like, a little thick skin and wrinkles out over here. In fact, guys, if you take a pin and you poke it out over here, you will see a fountain or this lymphatic fluid, that is your lymph, oozing out, guys, like this, like this, like this. This is how we actually treat it also in the other case. Okay, but guys, this is what we are looking at. This is nothing but your elephantiasis or filariasis. Okay, so the first thing, guys, is how are you going to get this thing? How will you get this disease? So, guys, we are going to see this thing. This is caused by the bite of Culex mosquito. See, I told you once again, see, in your dengue, we had your Aedes mosquito. Here, caused by the bite of female. Okay, it is caused by the bite of female Culex mosquito. Okay, now always remember, guys, only the female mosquitoes are going to bite. The male mosquitoes, they are going to be your fructivorous. So they live on fruits. But females, because they have to take care of the babies and the eggs, the developing eggs and all, so they require more nutrition. And for that, guys, they are going to absorb huge amounts of blood. Okay, so guys, that is your female Culex mosquito. Okay, and now what is this? Female Culex mosquito is going to be the vector. The actual causative agent is someone else. So let's try to see who is the causative agent. Sir, all female human and mosquitoes are blood suckers, it seems. Yes. Okay. 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 This is coming from a female only. Yeah. Okay. Guys, can you see the chat box by any chance? No, no, only the person who's messaging me can see, right? Okay, okay, okay. Take it, take it. Okay, okay. So now the next thing we are going to talk about your causative agent. Now, who is the causative agent? Guys, once again, this is going to be the nematode. And now, guys, nematode, there are actually 9 different types of these nematode. Okay, 9 different types. But now these 9 different types, they are actually going to cause 3 different types of your filariasis. Okay, 9 different types of nematodes cause 3 different types of filariasis. Okay, keep this thing in mind. Okay, chalo. Now, guys, let's try to see what are these 3 different types of your filariasis. Okay. So first thing, guys, we have lymphatic filariasis. Okay, and this is the one that we are actually looking for. Okay, this is what we are going to be studying. So we have lymphatic, FF is for filariasis, guys. Okay, so we have lymphatic filariasis where the entire lymph system is going to be blocked. You are going to see that the lymph no longer drains out, and it is going to be like, it is going to be like trapped in your muscles, tissues out over there. Suddenly there is going to be huge amounts of swelling in your arms and legs. That is it. Okay, so here always remember the germs attack the lymph system. Okay, the germs attack the lymph system. And guys, who are we looking at? Who are the germs out over here? We have Wuchereria bancrofti. So we have Wuchereria bancrofti. Okay, this is like, and guys, you need to know these names. Very, very important. Okay, and what we will be studying is the life cycle of Wuchereria bancrofti. So we have Wuchereria bancrofti. We have Brugia malai. Brugia malai. And the next one we have Brugia timori. Okay, so these are the ones who cause lymphatic filariasis. Then, guys, the next one that we have is subcutaneous filariasis, meaning this is the one which is going to be under the skin, guys. So this affects underlying layers of the skin. Okay, and now who are the causative agents, guys? We have Loa Loa. Okay, Loa Loa, and we have Mansonella species. Okay, and guys, in your exams, they will ask you this thing, Loa Loa. Okay, so you need to remember this name. Where is this prevalent? See, first, this is going to be prevalent in the Amazon area. So, yes, it is in the Africa. Okay. Along with this, guys, this is very prevalent in Sri Lanka. Sri Lanka and towards the coastal regions of India, like, towards the south part of India, like, the Tamil Nadu and all there. However, in India, it is not so prevalent. But then in the rest of the parts of the world, in your Africa, yes. In your Sri Lanka, yes. If you search on this thing also, YouTube, okay, you have an entire documentary on Sri Lanka, okay, where these people are like suffering a lot. So Manzanella species. Okay. And then, guys, the third one that we are going to have the serous cavity. So in serous cavity, guys, basically, we have the abdominal cavity. So here, the serous cavity filariasis, basically the abdominal cavity is going to be affected. Okay, so I'll just mention this affects abdominal cavity. Okay. But now, guys, who is the organism out over here? So once again, here also we have Mansonella species. That one. Okay. But now let's try to understand, guys, what exactly is going to happen. Okay. So let's see. Okay. First have a look. Then we'll see what is exactly going to happen. How is the life cycle going to be divided into? Okay, fine. Sure. Let's move ahead. Okay. 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 All right. Okay. So now, guys, when we talk about this filariasis, let's try to see. Okay, so filariasis basically it consists of two hosts. Okay, so the first host, guys, that is going to be your humans, and the second host is going to be your mosquito. Okay, so we have the mosquito and the human. Okay, both of them they are going to be the host. Now, first host is going to be the human, guys. Okay, and second is your mosquito. So how does it happen? So you will always see. Now I'll just give you a quick idea. Okay, so this mosquito bites a human suffering from the disease. Okay, so it initially bites a person suffering from filariasis. Okay, now when it bites, guys, now what is it going to do? It is going to pick up the germs. Okay, so it picks up germs. Now the moment it picks up germs, guys, now what happens? These germs they undergo a series of development in they develop in the mosquito. The germs develop in the mosquito. Okay, and now, guys, what happens as the germs develop in the mosquito? Then the mosquito bites another human. Okay, so the same germs are transferred. They're transferred to another human when they bite. Okay. So this is how the other person also gets the disease, guys. A healthy person gets the disease. And for this, guys, you will see that these germs, they undergo 5 stages of molting. Okay, so they will undergo 5 stages of molting. Okay, so now let's try to see how is that entire life cycle really going to be. See, I told you it starts with the human because the human has to be the sufferer, and the mosquito is going to come and it is going to, take away the germs. Okay, so let's try to see how this entire thing happens, guys. Okay, so guys, what are we going to see? See, first it is going to start off with a person who is suffering. Okay, so person who is suffering from filariasis. Okay, now what happens, guys? Because he's suffering from filariasis, he is going to have the nematodes. Okay, those worms, like for example, Visheraria branch of tree. Now inside his body, now what happens, guys? These differentiate. Okay, the nematodes they differentiate into male and female, guys. Okay, they differentiate into male and female. Okay, now as they differentiate into male and female, guys, immediately they undergo reproduction. But this time, guys, when they undergo reproduction, they are going to produce thousands of microfilaria, meaning small worms. Okay, thousands of microfilaria. Okay, now as these thousands of microfilaria are formed, these are going to enter into the blood and lymph. Okay, so they enter into the blood and lymph. This is the first stage, guys. Okay, now after this, what happens? Okay, now you're going to see that now when these microfilaria are in the blood and lymph, so this person is actually technically infected. Okay, so when the female mosquito comes and bites, okay, the okay, so immediately you will see that female mosquito bites this person. Okay, you are going to see that now the microfilaria enter into her body. Okay. Now, once into her body, guys, see, actually, when we talk about the humans, okay, in humans, guys, you are going to see two stages of molting taking place. Okay. So keep this in mind. In humans, two stages of molting. Okay. But now, when they enter into her body, guys, now what happens? They undergo three more stages. And this may take a little while. Okay. This may take a little while. Okay. They undergo three stages of molding. Okay, and now what happens once these three stages are, they're complete? Now, once again, this Culex mosquito is going to deposit the germs wherever she is going to bite. So Culex mosquito bites another host. Okay, another human host, a healthy host. Now what? Once again, the germs are transferred. Okay, you will see germs are transferred into the human. Okay. Now, the moment they are transferred into the human, how are they going to be? First, they are going to be transferred subcutaneously, because see, the mosquito is going to bite and the proboscis is going to go under the skin. So this is going to bite subcutaneously. Okay, fine. Now, in the human, okay, in the human, guys, they undergo two stages of molting, like I said. Okay, so they undergo two stages of molting. And now this can take some time, guys, over 1 year. Okay, over 1 year. So it's a very, very slow process. But now, after 1 year, guys, what are you going to see? Immediately, this starts attacking. Okay, these germs, they start attacking the lymphatic system. Okay, and now the moment the lymph system is going to be attacked, guys, the entire lymph system becomes blocked, and now this is going to result into swelling. So you will see swelling of the arms, swelling arms, legs, etc., groin, etc., okay, abdomen, etc. And now the moment you have this thing, guys, once again, the person is said to be suffering from filariasis. Okay, so human host, guys, human, it is going to show you two stages of molting, and mosquito host is going to show you three stages of molting. Okay, so just keep this thing in mind, guys. Okay, just see if everybody is okay with this thing. If you are okay, then we can quickly just move ahead. Okay, just see, guys, very, very important, because in your exam, guys, this will be asked for, like, 3 marks. Just draw the life cycle. Okay, or they will ask you to write a short note. If they ask you short note, it will come for 4 marks, guys. So you need to know this thing absolutely properly. Okay, whatever was happening above the line, this is your human host, huh? And whatever is happening below the line, that is human host, and this is your mosquito host. That Okay, everybody all right? Okay, sorry. Just have a look, guys. Okay, sure. So guys, now let's quickly just talk about the symptoms and all and just finish this thing off. Okay, so if we look at the symptoms, okay, what are the symptoms out over here? So I told you symptoms, most important thing is swelling. So you are going to see swelling, and swelling is nothing but we call it as edema. Okay, so swelling or edema. And guys, where is this edema going to be seen? Okay, so you are going to see this edema, guys. This is going to be seen in your legs. It is going to be on your hands. Okay, it is going to be even the breasts, vulva, even the testes, guys. Okay, now actually what happens, I'll just show you. Okay, so this is a normal person. Let's imagine this person is suffering from filariasis. Okay, so like this, let's say the left hand side is normal, but guys, let's say the right hand side is affected. Okay, so you will see something like this, guys. Okay, so if it is in the hands, you will see it like this. If it is in the legs, guys, you are going to see it this way, like this. Okay, so it's going to be like completely swollen up. And plus, guys, what I told you, this can happen in your testes also. So, guys, what you will see is you will see that the testes, that is the scrotal sac, is going to enlarge like this. It is going to be huge. Okay, so let me just show you. Okay, so guys, this entire thing, it is going to be like huge. Because this has gone huge, guys, the penis becomes so small, it is actually going to be hidden. You won't be able to see it. Guys, let this situation, this is called as actually hydrocele. So let me just zoom in into this and let me show you what exactly is going to occur. So guys, this the scrotal sac, it is going to be so huge, it is going to be filled with your entire tissue fluid out your lymph. Okay, and now the testes, guys, whatever that were there, they are going to degrade, they are going to degenerate, guys. They're going to degenerate. And now you are going to see that the penis has also shrunk. It becomes like a small opening kind of thing right out over there. And this entire thing, guys, entire thing, this is filled with your tissue fluid. Okay, now this can contain even liter 2 liters of fluid. Okay, it is that way, guys. So once again, if how do you have to remove, you have to just poke this thing, why do a little bit of operation, remove that entire fluid out, because the lymph system is going to be blocked. Fluid cannot move up and down, guys. That is the problem. What do we call this thing? This is known as hydrocele. Okay, this is known as hydrocele. Okay, and always remember this hydrocele is filled with tissue fluid. Okay, and finally, guys, what is the treatment? Is this curable? So second, one more system. See, one more thing, guys. I told you, you know, how is the skin? The skin is going to be really thick out over here, wherever it is present. Okay, so the skin is going to be rough. It is going to be tough. It is going to be folded. It is going to be thick, and this is going to be tough that way. Okay. And finally, guys, what is the treatment that is given for this thing? So there is only one thing out over here. So we have diethyl carbamazine citrate. Diethyl carbamazine citrate. Okay, and generally how is it, guys, when you are initially infected, when you know that you have turned out to be positive? So this is given twice a day for 3 weeks. Initially it is going to be given for 3 weeks, and after this 3 weeks are done, guys, then the same dosage is given, okay, like one in the morning, one at night, but then this is going to be continued for 5 days a week. And this regime will be carried out for the next 6 months. This is how the treatment is done. Okay. For you guys, what do you remember? You need to remember diethyl carbamazine citrate. You just need to remember this thing. Okay. Chalo. So guys, with this, we are done with your entire filariasis as well. Okay. So guys, just quickly go through this thing. Just have a look at it, and then we'll see the next ones in the next class, guys. Okay, sure. So guys, we'll stop over here for the day, and I'll see you in the next class. Till then, take care. Bye bye, everybody. Bye bye.